Hi everyone, it's Belinda K here. I'm a naturopath and a nutritionist, and today I'm going to be talking to you about heart health. Now, this is a really important topic because chronic heart disease is one of the leading causes of death in Australia, but also in many Western countries. Now, men have a fairly constant risk of heart disease. Women start with a lower risk, but then that increases as they hit menopause and their estrogen levels fall. Now, estrogen is a trigger of nitric oxide in the body, and nitric oxide widens blood vessels and decreases blood pressure. So before menopause, women are actually fairly protected from heart disease because they've got this natural way to trigger nitric oxide, but after menopause it decreases dramatically. One of the great things about nitric oxide is that it can be made in the body, triggered by estrogen, but that you can also consume it as dietary nitrates that your body will convert into nitric oxide, like leafy greens. So we can use foods and diet to support a healthy heart and lower blood pressure. The best diet for preventing heart disease is one full of fruits and vegetables, whole grains, nuts, fish, vegetable oils, and includes alcohol only in moderation. Goes easy on processed meats, refined carbohydrates, excess sugar, foods with trans fats. Studies have shown that people with diets consistent to this dietary pattern had a 30% lower risk of heart disease, which is heaps. They did some research finding that a Mediterranean diet supplemented with extra olive oil or nuts, which are both rich sources of unsaturated fats, reduced the incidence of heart cardiovascular disease compared to low-fat diets. So it is really important that we actually keep those healthy fats in there. So when I said vegetable oils, I meant things like olive oil, nuts and seeds, not processed oils. Now, there isn't one Mediterranean diet, and it certainly isn't pizza and pasta and Aperol spritz, which is unfortunately not the best diet for heart disease. There's similarities that really define this Mediterranean style of eating, which is the olive oil, nuts, fruits, vegetables, fish, lower intakes of dairy, some red meats but not heaps, and then keeping sweets and wine in moderation, or alcohol in moderation. Things to avoid really are that sugar, processed foods, trans fats and alcohol, because they create inflammation. And any foods that have trans, hydrogenated or partially hydrogenated oil, which means they're bad fats on the label, we want to avoid those. So fried foods, popcorn at the movies, biscuits and things like that. Don't forget that exercise can decrease your risk of heart disease as well. Trying to keep your waist circumference under 88 centimeters is really important. Make sure that you're getting adequate sleep. Check that you're not mouth breathing, because when we breathe through our nose, that helps to increase nitric oxide production. So if you're a mouth breather, it might be worth taping your mouth at nighttime to encourage that nose breathing, obviously assuming that you're okay to breathe through your nose. Keep your blood pressure and cholesterol levels checked regularly with your GP. Try to manage stress and make sure that you're getting enough sleep. So hopefully this gives you some information about how to best eat and manage your heart health and to support a healthy heart all the way through the lifespan. Remember, it's those leafy greens that really give us heaps of these nitric oxide sort of precursors, and they're the ones that help to relax the blood vessels and can really help you to reduce your risk of cardiovascular disease. Thanks everyone.